My name is Janet Navin. I am a nursing instructor at Waukesha County Technical College in Pewaukee, Wisconsin. This unit in the Helen Bader Foundation CBRF Caregiver Training Program is going to be on standard precautions in the CBRF. In this unit, I will be narrating between video segments that will be presented by Virginia Romaine, a nursing assistant instructor from Lakeshore Technical College in Cleveland, Wisconsin, and Ann Hansen, infection control practitioner from Infection Control Associates in Manitowoc, Wisconsin. You will see a variety of settings in these nursing assistant videos. Sometimes the setting will be in a classroom, a nursing lab, or the hospital, and residents will often be referred to as patients or clients. The unit will be divided into 3 parts. The first, asepsis, the second, infection control, and the third, bloodborne pathogens. We'll start the standard precautions unit with the pretest. Remember, the pretest and the post-test are both the same test. Your responses will not be graded and will be reviewed after you have taken the post-test at the end of the unit. When we come back, Ginny will begin this unit with Part 1, asepsis. Now, turn off the videotape and complete the pretest.
Medical asepsis is one of the skills that you will be involved with throughout your entire day as a nursing assistant. Medical asepsis skills really involve the control, the trying to stop the spread of microbes that will cause disease or illness. When we talk about the skills in this session, we're talking about things like hand washing, how you handle linens, where you will store equipment, disposal of trash, your own hygiene and cleanliness. We're talking about those skills really that are concerned with microbes and reducing the spread of disease-causing germs. When I talk about microbes or microorganisms, I think it's fair to say that we have many terms that we can use for these particular organisms. And let's take a look at those terms. You will see that they might be called microbes. And a microbe is a shortened verb, or term, I should say, for a microorganism. Micro meaning microscopic, and an organism is a living being. These are microscopic, non-visible to the eye, and frequently we call them germs, especially the ones that cause illness or disease. But we might also call them bacteria or yeast or mold or fungus, viruses, and then we might also add worms or parasites to this list. When I talk about microbes and microorganisms, we need to talk about the fact that there are 2 different types that we'll need to concern ourselves with. The first type is the ones that cause disease. These are the harmful ones. These are the pathogens, or we call them pathogenic organisms. Pathogenic would be the adjective. Then we also have non-pathogens, and these are the ones that we learn to live with side by side daily. They usually do not cause illness or disease, unless, of course, they get in the wrong place, and then they go at their business. When we talk about microbes, we need to take a minute to take a look at some of their characteristics. And I really do believe that if you understand what they need to grow and live and what they need to spread, it will help you tremendously to understand why the practices that we talk about are so important. So let's take a look at the various characteristics of microbes. What do they need in order to live? Well, we know one of the most common things that they need is food. Microbes need food just as you and I need food. We know that they don't really care what kind of food they eat, and of course sometimes that might be garbage, it might be the food left over on someone's plate, and it might be things that you and I would certainly never consider eating. But that to them is food, and they need this to live just as you and I do. They also need moisture. Moisture in the form of water, body fluids such as blood, urine, stool, perhaps wound drainage. They don't care if the liquid or moisture is thick or thin. They just like that moisture, and they will live anywhere with that. They need that moisture to have their food actually be absorbed through their cell wall. And they will, of course, live on soap that is sitting in a wet dish. So moisture is important to microbes. It helps them to carry on their bodily functions. We also know that warmth is a very important characteristic needed by microbes for life. If they're going to cause disease in humans, they pretty much need to have a 98.6 roughly in that category temperature. We know that freezing does not kill microbes, it just slows their growth, and usually high temperatures will kill most bacteria. Certainly we know that they will be killed if they're in what is called an autoclave or a pressure cooker, which is steam under pressure. We also know that microbes require darkness to do most of their growth and reproduction. Sunlight, and especially the ultraviolet rays of the sun, really do a great deal to destroy microbes. They do not like the light. Consequently, when you find that you have dark, moist, you have areas where there's plenty of food, and then another characteristic that this microbe needs is oxygen, we will find that we have a great growth of these microbes, and they can certainly cause a lot of problems in terms of infection, in terms of food spoilage. Perhaps they also cause what we commonly come to call odors or various smells. And we notice that we can tell the presence of microbes by the odors that are present. Think of the food that has spoiled in your refrigerator, perhaps, or if it was left on the counter. You remember perhaps what that smelled like. Where are microbes found? I think we can just simply accept the fact that they're found everywhere. They're found in the air around us, they're found in our bodies and on our bodies. They certainly are found on our clothing. We know that they're found in the soil, they're found in decomposing garbage and trash. They're found everywhere. And I think we have learned that we do need these microbes in our environment. However, there are some areas that have a greater buildup than others, and this is the area that becomes harmful to us. These are the areas that we know, such as the floors, wherever bedpans or urinals are stored, such as the bottom shelf of the bedside cabinet. We know also that where the patient sits, perhaps the seat of the chair, as well as the bed linens on the bed where the patient has been, also are quite high in microorganisms. Bathroom areas, especially the toilet or the inside of the sink area, we know are very high in microorganisms. And we know that the utility room, where you might find such things as hopper sinks or trash stored, are also going to be full of microbes. But then what are some clean areas that you might find in the facility? We know we might find clean areas, particularly where linen is stored and kept until it's being used. Treatment and supply areas are always considered clean areas. The overbed table where the food is placed on the tray is certainly a clean area, as well as the top shelf and the drawer in the patient's bedside stand. Also, the food carts that come from dietary are definitely considered clean, and your uniform should always be considered clean and should be clean at the start of every day. Well, if we know that there are clean and dirty areas in our environment, let's think for just a minute about where germs might be found on our bodies. And I think if we take a look at this again, you'll see that these are probably areas that you have already learned are areas that require special attention or special care. We know that stool or bowel movement, the feces from the intestine, is made up of a good percentage of bacteria. We know that sputum coughed up from the lungs, this has cleared the air passages of the debris, the bacteria, the microbes that are collected in there. Sputum has definitely a high content that can be harmful to us. We know that the vaginal discharge also might contain microbes, as well as the fact that we have microbes on our skin surface and particularly on our hands. We know too that the mouth and throat are considered areas where there's certainly potential for infection if a person bites you, or if you are to take food or drink from utensils that they have just used. I really need to stress that microbes are not necessarily harmful until they spread to either another person or another place where they're not supposed to be. And that is when they can cause their damage or their their destruction. It is something I think that the nursing assistant needs to know. How are microbes spread? And if you know something about where they will grow, what they need to grow, and how they will spread from one place to the other. After all, they don't have little feet and can carry themselves or walk, or they don't have wings that can fly. They have to be carried or somehow spread or transmitted. One way is by direct contact. This is by directly touching that patient with your hands. You have come in skin-to-skin contact with that person, perhaps bathing or toileting them. You might also come in direct contact, perhaps if you stick yourself with a needle that has been in the patient. We also know that indirectly we can contact these microorganisms, such as the glass that the patient was drinking out of, or touching the bedpan that you now have to empty. Their dressings, their used tissues definitely contain microorganisms. We know too that we can contact microbes, come in contact with them, by inhaling the droplets that come from a cough or a sneeze, or even from talking. Now, if you measure about 3 feet in front of you, roughly it's about arm's length if you hold your arms straight out. That is about the distance that droplets, while you talk, or certainly when you sneeze or cough, will go farther, will carry. And if that person is within that distance, it's very likely that they will inhale those droplets. We know that airborne microbes are also carried on dust particles that can be carried through the air. Consequently, if you recall, we talk about not flipping the sheets in the air to spread the germs from one area to another. We talk about when you clean up an area that you have a damp cloth for cleaning up so that you don't spread dust more and more. We also know that we have some common vehicles that carry microbes. This would be such things as water, as I said. We also know that blood can carry microbes, as well as, of course, food that is left in an area, unrefrigerated. We know that many times we can protect ourselves from coming in contact with this type of microorganism, and we will talk more about that direct contact with blood and body fluids in another tape. There's one more that I'd like to have you take a look at that has to do with how we spread microorganisms, and that is the various insects that one might see. I know that you will find that you have, I'm sure, seen the housefly. Perhaps you've seen the mosquito. The cockroach also carries microorganisms as well as moths. Certainly the bedbug, the ant, the louse, the flea, and the termite all will do their share of carrying microorganisms wherever they walk or land when they fly. Now, that's something that's not new to you, I'm sure. We've all learned that. What about the body's response to pathogens, to these disease-causing microorganisms? Well, first of all, our body has numerous defenses, and just a few of them include the intact skin. The skin covering on our body should be intact. Whenever we have cuts or scrapes or opening, perhaps such as from surgery, potentially microbes can get in if we're not careful. And of course, hand washing and good cleanliness becomes essential at this point. We know too that mucous membrane that lines the eye and the mouth, the vaginal passages, are secreting substances that are very protective by nature, and they help to control the entrance of microorganisms wherever the body openings are. Also, in the nasal passages, remember I talked about the cough or the sneeze. Well, this is a cleansing mechanism, and it is a way to help clean out, to rid the air passages of the debris and the bacteria that are trapped there by those hair-like projections called cilia. We also know that the body has the inflammatory response, which is a great mechanism for helping the body to protect itself against both physical injury as well as invasion of microorganisms. We also have immunizations, which do a great deal to help us fend off these infectious diseases. And then I think another way that our body can be defended is that you learn how to protect yourself. You learn how to use these various skills so that you don't have to get sick or ill or have an infection. And certainly you don't want to be spreading them either. How do we know that an infection is present? Well, our body also has given us certain signs that we can see when we have an infection. And basically, we'll find many times that our body has a fever. The fever is the body's way of elevating that temperature enough that the microbe will be uncomfortable and certainly not do a great deal more growing at best. We know too that swelling and pain and tenderness many times are a result of infection. The swelling causes pressure on the nerves and the resultant pain. Many times though we know that discharge, especially if we notice that that discharge has pus in it, is a for sure indicator most times that we have an infection, a microbial infection. Discharges should be also observed for their color. You might see sometimes that the pus has a yellow color or a greenish color, or perhaps just a plain milky color. This should be reported, as well as any odor that you notice. Fatigue, loss of appetite certainly might indicate that the body is working hard to fend off an infection. And then there are other signs that you might notice that will give you the clue that an infection is present. This would include such things as diarrhea, coughing, sneezing if it's in the upper respiratory passages, and then certainly vomiting sometimes, especially if that person has had a contaminated food, will clue you in that an infection might be present. What are some ways then that we can control our, our bodies so that we don't have to get these infections? One of the most common ones, of course, we've already talked about is personal cleanliness and hygiene. We simply can carry germs on our bodies, on our uniform, as we work from patient to patient. And as you go from person to person in any day, you are picking up and adding germs to your clothes as you come in contact with them. For this reason, the uniform becomes contaminated very quickly and should never be worn 2 days in a row without being washed. If you only have one uniform, you're expected to wash it at the end of the day before you wear it again. We know too that hand washing is an important skill for your own protection. Hand washing is always done before and after contact with each client. And this is vital to preventing the spread of disease from person to person. And remember, that person might be you as well. When do you wash your hands? Well, you want to wash your hands before you start your work, certainly, as I said, before you start to care for your patient. Prior to eating or handling clean linens, you would want to make sure that they're clean. You also need to make sure that we wash hands after we care for patients. Certainly at the end of the day, before you leave and go home, you want to wash your hands, as well as after feeding or after eating. Certainly after toileting either the patient or yourself, and anytime you handle used equipment. Now, anytime you sneeze or cough, most people are taught to put their hand in front of their nose or mouth when they sneeze or cough. You should wash your hands. Remember, what is being cleared from your air passages is now on your hand. And then, of course, whenever in doubt, wash your hands. That's the safest way. We'd like to take a trip to the nursing lab at this point and take a look at a demonstration on hand washing. I'd like you to notice the 3 main points when one does hand washing. You must have adequate soap for lather. This helps to lift the debris from the skin. It also helps to break down the oils that would hold the debris and the microbes. We need, of course, running water that should be at comfortable temperature to wash this away. And then, in addition, we need friction. Friction creates heat, but it also helps to create that motion that helps to lift and remove those microbes as you're washing your hands. Let's take a look then at this procedure and see what you will need to remember. In this demonstration, what I would like to do is to explain a few principles and to demonstrate the procedure for hand washing. First of all, let's look at what's meant by capillary action. Capillary action is a sucking up of fluid, so to speak. And if you notice with this water on the counter, if I put a paper towel on top of that, notice what happens on top of the paper towel. That water is being sucked up by the paper towel. That capillary action is not only pulling the water from the counter, but also any microbes that perhaps were on that counter or dirty area as well. Consequently, with my clean hand, if I now touch that wet paper towel, all the germs that were on the counter are now on my hands. And of course my hands would be dirty and I would have to wash them. This is an important principle to keep in mind because one of the things you must remember is to turn the faucets on and off with a dry paper towel. And as I turn the faucets on and off with that dry paper towel, I'd like you to keep in mind that capillary action. In order to do hand washing, I first prepare my area. I make certain I have a running water source. It's always important to use running water when you do wash your hands. I will always make certain that if I have a choice, I use dispenser soap versus the bar of soap that might be sitting in a wet dish. Remember, wet soap in a dish, particularly it's sitting in water, is a microbe-full source, and this could be very contaminating instead of cleaning for your hands. Making certain also that I have paper towels. I want to use paper towels only once and then discard them. Never reuse cloth towels if at all possible. The other thing that's important for your area is to make certain that when I am washing my hands, I do not touch the inside of the sink. The inside of the sink area is also considered contaminated, as are the handles. Remember, the handles in the sink area are touched by dirty hands, and you want to make certain that your hands keep as few microbes on them as possible. With that then, I'm going to turn the water on with a dry paper towel and adjust the temperature accordingly. And then I will discard that towel. In order to wash my hands, I want to make certain that my hands are wet and that I use adequate soap to build up a lather. I want to make certain that all skin surfaces are washed. I want to use good circular friction motions, and that friction is one of the best things that you can do to help lift not just soil but microbes from the skin surfaces. Making certain that I use enough vigorous strokes to build up a good lather. Making sure that I get all the folds of the skin, get my wrist area, and you notice that I have moved my wristwatch up my wrist enough that I can get the wrist. In addition to the skin surfaces, I must get my nails and several things that I can use. I can use the orange stick and the blunt end of that stick to get under the nails. Here is a plastic device which I also can use, and these are disposable. They can be disposed of once they're used. Or I also can use a nail brush, and a nail brush also is very effective for getting underneath the nails. Remember, in order to wash all surfaces, you do have to wash under your nails as well as the skin surfaces. When I have washed my hands thoroughly, I then want to rinse. And I always will keep my fingers pointing downward. I will rinse thoroughly, making certain that I get all of the surfaces rinsed to avoid chafing or irritation to the skin. Keeping my fingers pointed down as much as possible. I want to dry both hands. Making certain that I get all surfaces dried thoroughly to avoid chafing. And then I will discard those paper towels in the trash. Remember to turn off the water. I now use a dry paper towel, making certain that I keep my clean fingers away from the dirty faucets, and then I discard that towel in the trash. And finally, in order to prevent dry or irritated skin, it is important that you use lotion. And again, the lotion will help to maintain the lubrication in your own skin. I point out to you that hand washing is the most effective, the most significant way that you have of preventing infections, either in your own self, your family, or from cross-infecting other patients. Keep in mind, hand washing is your single most effective skill for stopping the spread of infection. Some other methods that you can use to help control the spread of microorganisms, in addition to cleanliness and good hygiene, and of course the hand washing, is to make sure that we keep clean and dirty items separate. Now this is not difficult, and most facilities have clean utility rooms and dirty utility rooms. But it is something that you as an assistant are responsible for maintaining. We know that when we talk about clean and dirty items, we need to have an understanding of just what these terms mean. So let's take a look at these terms again and see what we have to remember. When I talk about these, I think you'll find that it's much easier to remember them in terms of clean, dirty, and then I'm going to add a third term, sterile. A clean item has no disease-causing microbes. Now, it may well have microbes, but they are not going to cause disease. The linen that you take from the cupboard is clean. It has been washed, but it is not sterile. If an item is dirty, it has disease-causing microbes on it. We know that disease-causing microbes are the ones that are the harmful ones, and therefore anything that we carry or handle that is dirty must now be treated as a very germ-laden or microbial hazard. We know that sterile refers to something that has no microbes at all on it. A sterile item has no good microbes or bad microbes. It is simply sterile with no microbes at all. If you keep those three terms in mind, I think you'll find that it's not difficult to try to keep clean and dirty items separate. You would never want to take a dirty bedpan into the clean utility area where clean items are stored. And the reverse is true. If you are to take a clean item, such as, let's say you have a package of clean linens, and you take it into the dirty utility room and lay it down on the counter while you maybe wash out a bedpan or something, those linens are now considered dirty or contaminated because they touched that dirty area, and they would have to be disposed of in the laundry. Another method for controlling the spread of microbes is to maintain a clean environment for that patient, as well as for yourself. Now, as I said, the maintenance and custodial staff will keep the place looking sharp and very clean. But it is also our responsibility that should we spill things, or should you find trash where it shouldn't be, or when we dispose of trash, it is our responsibility to do this properly. We need to also have what is called a safe and responsible attitude. And how do you show this safe and responsible attitude? Well, you show it by what you do. You show it by wearing clean clothes daily, by having yourself well groomed and kept clean, having clean hair, clean nails, having no body odors. We know that you will also follow good hand washing procedures and following the principles of medical asepsis. Remember, as you follow these practices, I think you'll find that you will feel safer in the long run. Yes, it might take an extra minute or two, but think of the time you would lose if you were to have an infection or give one to your patient, who would now have extra time and money to have to spend. So again, good attitudes and good medical asepsis practices say that you do care about yourself as well as about your patients.
Welcome back. Ginny certainly has given us a lot of basic information and some simple, effective guidelines for controlling the spread of germs that will keep your residents healthier in the CBRF. On this next video segment, Part 2, Infection Control, Ginny will talk to us more about what caregivers can do to prevent the spread of infection and disease in their CBRFs. When Ginny finishes, I'll be back to talk to you a little bit about the history of infection control, what the CBRF regulations say about standard precautions, isolation procedures, and then we'll review some posters on the standard precaution guidelines. Now, let's get back to Ginny.
This lesson is going to deal with the topic of infection control. Now, infections, we know, are common hazards for all of us as human beings. However, in a facility such as a nursing home or even a hospital, we have more people in contact with quite a few other people, so the chance of spreading germs is very frequent. Let's look at the first word in this, namely infection. What are some things that are important for you to remember about the infection? We know that an infection is the body's response to the invasion of microbes or pathogens, and I'll probably just refer to them here as germs, simply because I think that's a word most people understand. We know that these germs, or microbes, can get into the body in a variety of ways, through perhaps cuts on your skin, perhaps on the fingers that you take to your mouth, perhaps the food that you eat, Perhaps they can get into your body through the air that we breathe or as we come in contact with someone's cough or sneeze. Now, those are certainly not pleasant things, and we're all used to this. Remember, we've learned earlier that our body does have a protective responses to help protect us from these infections on a daily basis, so to speak. But we know that when infections do occur, they certainly cause discomfort, they certainly can cause illness as well as disease, and they can even cause death. We know that infection will spread in many ways. We can have cross-infection from one person to another, such as when one person has, let's say, the flu. Perhaps you've been exposed to young children when they start school. And you notice that first week or so of school, everybody has a case of some flu, or there's a cold, or there's some illness going around, because they've had a chance to cross-infect. We also know that people can reinfect themselves with the same microorganism. And this happens many times, especially as our immunity is compromised or not as perhaps sound as it would be when we're healthy. The other word that we want to look at today in infection control is the term control. Now, we know that infection control involves various ways, measures, practices that you as an assistant will use to help prevent the spread of disease or illness. Now remember, the person that this might spread to is you yourself. So it's important that you follow these practices every time you work with the residents or patients. Now, these practices are supposed to be followed by not just you, the assistant, but also by physicians, by nurses, and by other people who routinely have contact with these patients and residents that might have an infection. Let's take a look at the basic rules, and instead of having you take large amounts of notes right now, I'd like you to simply look at your notes that you have in front of you and follow along with me as I review these rules. You notice that the first rule is to wash your hands. These hands and the 10 fingers are the most common carriers of disease that we have, because these hands and fingers touch just about everything. Now, it's important for you to know that the most inexpensive way for you to prevent the spread of disease, the easiest for you to do, is simply to wash your hands as you are expected to. Remember, we always wash hands between patients. You are going to hear washing your hands between patients. Wash your hands before you do a new treatment. Wash your hands after you touch something dirty. You're going to hear the terms wash your hands repeatedly throughout not just this tape, but also other lessons as well. And again, you're going to hear it repeated over and over because it is so important. And it does work, by the way, if indeed you do wash your hands as you're supposed to. You always want to wash your hands after you remove gloves. Now, gloves are going to be used frequently as we handle infectious waste. But these gloves are only going to protect your hand from a portion of the microbes. They are going to develop holes. Microbes or germs are going to get underneath this. Also, as your hand is in that glove, it's going to become wet and moist. The perspiration, along with the materials that you have on your hands, such as dead skin cells and other items that we frequently have on our skin, is going to also be a growth place for microbes. So you will have to wash your hands after you take your gloves off. And certainly, you want to make sure you wash your hands anytime you handle infectious waste, and we will be reviewing what that means shortly. Another important rule of infection control is that you handle supplies aseptically or properly. Now, you know the term aseptically, you remember, refers to preventing the spread of disease, handling things in a way that doesn't encourage infection or spread. You have thermometers. You will learn about the importance of working from clean to dirty, of wiping the thermometer from the stem end toward the bulb end. We will learn about the importance of scrubbing out equipment such as your bath basin. We know that inside of that bath basin develops a ring, just like on the inside of your bathtub. And when this develops, that provides a good medium for the microbes to grow. We know that bedpans, urinals, all items that come in contact with the patient should be cleansed and disinfected regularly. Another rule of good infection control, it is vital that you follow good hygiene practices for yourself, certainly a daily bath, keeping your clothing clean, washed after every day that you wear it to the clinical area. Important that you realize that what you do with your body to protect it from infection is vitally important for your health as well as for the health of others. Certainly, whenever you are going to handle any infectious waste, any of the body fluids, any of the things that come in contact with body fluids, such as perhaps a bedpan, perhaps it's dirty dressings, you must wear gloves. Now, I know some places and some people say, well, it's just too expensive to wear gloves all the time. Well, I also feel it's very expensive to have an infection, either for you or for your patient as well. Gloves come in several types. You might have what's called a vinyl glove. This is a glove that doesn't always fit the hand quite as well. It's usually used for both hands. I could put this on my right hand or my left hand. Or I might have what's called a latex glove. And this glove fits your hand literally like a glove. It fits it nice and tight and snugly, and most people prefer this type of glove. But there's some problems for some people with this particular material, as well as the powder that might be on the glove. And if you notice that your hand becomes reddened, or if you have any skin problems when you wear these gloves, you want to report that to your supervisor, very likely. But very likely, you want to not use this type of glove and simply use the vinyl glove instead of the latex. Gloves are a very important help to preventing the spread of disease. However, you still must wash your hands, remember, after you take those gloves off every time. A few other points about gloves, which I think are important. They're only worn for one patient. You never wear this from one patient and then go to another patient. You must remove them between each patient. And then the other important thing to note here is gloves are always disposed of after each use. They are never reused. Important also that you keep items separate. Now, in your bedside stand, you have several shelves and a drawer. And if we look first at the cupboard, you'll notice that the two shelves have equipment. And one of the important things that you must remember is that equipment is kept separate. Another important part of keeping clean and dirty separate is making sure that the overbed table is kept wiped and clean, but we do not put bedpans or urinals on the overbed table. This particular area is considered clean. It is where the patient's dinner tray will be set, but also where treatments such as dressings, perhaps various things the doctor will use to help change a patient's bandage will be put on that. This area has to be kept clean. Personal items for the patient, and you notice we looked in the top drawer. Some things that you might find in there would be such things as the razor, perhaps that the patient uses daily to shave. It might be electric, it might be a regular razor. We might also have nail care equipment, perhaps other items that the patient would use. These must always be kept separate. And the new rules are such that each patient now resident must have their own equipment. This is not shared. It's very easy, perhaps, that tiny nicks in the skin could develop, and very small amounts of blood could become part of this shaver or these nail clippers, and of course spread from other people if we're not careful. So the new recommendations are that each patient have their own clippers as well as razors. Now, when we talk about infectious waste, let's take a look for a moment at a list of things that might be considered infectious waste. Infectious waste includes such things as used dressings and bandages, colostomy bags, urinary drainage bags, the used gloves we talked about, perhaps tissues that have been used for somebody while they sneezed, dirty diapers from both adults as well as children, chucks, those are the blue pads that might have bowel movement or urine on them, as well as tubes which are removed from the patient, such as urinary catheters or intravenous tubing. When we dispose of infectious waste, I talked to you about the symbol that's on here, but we also want to make sure that you understand what that symbol is. Because as you dispose of these infectious waste, you will of course have to put that in some container, whether it's a red bag or perhaps one of these containers that you see here where we might dispose of a used hypodermic needle or insulin needle. This container is red, it's rigid, you notice it's solid, and on the front we have a symbol, this biohazard symbol. Let's take a look for just a moment at that symbol up close. You'll notice that it's a series of rings, might be red or black. This biohazard symbol refers to bio for life and hazard referring to something that is dangerous. This contains a substance which potentially is harmful to the human, causing human disease would be the harm that we're looking at here. So as you look at that biohazard symbol, which you'd find on the front of this container, you know that what's in there is going to potentially be very hazardous to your life as well. If you should find needles that are loose in the patient's room or area or on the floor and you must dispose of them, what's important is that you locate the proper device. Keep in mind this must be a rigid container, one that needles will not be able to puncture. It also must have the biohazard symbol on it. And to put needles in this box, it's important that you use the levers that open the area for you to drop the needle in. Simply drop the needle in, and at no point should you put your fingers in this area. This is designed so that you do keep your fingers out, but at no point should you try to go in and retrieve something. Another important point for you to keep in mind when you're dealing with disposal of sharps, whether it's needles, disposable scissors, or glass, you may or may not be able to use such things as metal coffee cans with a lid or plastic soap containers. Regulations as well as policies in your area may prohibit the use of these devices. Another protective device that you might find available to you is a physical barrier which would be used as part of the airway tube that might be placed in the person's mouth should mouth-to-mouth resuscitation be required. This provides a barrier between your mouth or the rescuer's mouth as well as the secretions of the person who is being rescued. The body fluids that you might come in contact with include such things as bowel movement or stool or feces, and perhaps it's either in more solid form or it might even be diarrhea as well. Certainly urine, vaginal discharge such as you might find when the woman has her monthly period or menses. Also there is semen. Blood we certainly hear a lot about, and you see that blood is probably one of the most obvious ones that we hear about. But there's also wound drainage as well as pus, certainly a very infectious fluid. Also saliva, which many times does contain blood, as well as vomitus, or the emesis that is thrown up from the stomach.
Welcome back again. Thank you, Ginny. This is certainly a lot of information to remember. I hope that you're following along in your notebook and taking notes. Feel free to stop and review the tape any time that you might think it's going a little too quickly for you. Now let's take a look at the history of infection control. Infection control history. The first part is universal precautions. In 1985, the United States Department of Human Services Center for Disease Control, the CDC, we often refer to it as, and the Occupational Safety and Health Administration, we refer to this as OSHA, established guidelines for infection control. These guidelines were for healthcare providers to follow to prevent the spread of disease and were called universal precautions. Under the universal precaution guidelines, it was assumed that only those people diagnosed or presumed to have an infection or disease posed a risk of transmitting infection or disease. We now refer to our infection control procedures as standard precautions. In 1996, the CDC and OSHA established new and revised guidelines for infection disease control called standard precautions that all healthcare workers are required to follow. The standard precaution guidelines are clearer and more organized. The biggest difference is that the standard precautions are used for all residents receiving care, not just those diagnosed or presumed to have an infectious illness or disease. HFS 83 in standard precautions. Standard precautions means measures taken to prevent the transmission of infection from contact with blood or other body fluid or materials having blood or body fluids on them. As this recommendation is made by the U.S. Public Health Services Center for Disease Control and adopted by OSHA. Copies of the standard precautions may be obtained from the state offices in Madison. Number 2, the minimum training regulation requires that the administrator, all resident care staff, and all other employees who may be occupationally exposed to blood or any other potentially infectious material shall successfully complete training in the standard precautions to prevent the transmission of blood-borne infections and infections from any other potentially infectious material. This training shall occur prior to the employee assuming any job responsibilities which may occupationally expose him or her to blood or other potentially infectious material. OSHA standards require an employer to provide annual training updates in the prevention of blood-borne infections to all staff who may come in contact with the blood of a resident. 3, each CBRF shall have policies and procedures in specific detail regarding infection control. These will include standard precaution guidelines and airborne precautions, droplet precautions, and contact precautions. An exposure control plan, which is a plan designed to eliminate or minimize an employee's exposure to body fluids, including exposure determination, who is covered, what PPE, personal protective equipment, this includes gowns, gloves, masks, etc., that the employer is providing to the employees. Who is responsible for seeing that the personal protective equipment is available to employees? An important aspect is the provision of hepatitis B vaccine, post-exposure follow-up, appropriate record keeping, training, and an annual review of the plan and an update whenever necessary. Isolation procedures. Residents with infectious illness or diseases need to be separated from others for 2 main reasons. Number 1, to protect the other persons around them from getting the illness or disease, and to protect the person with the infection from getting additional germs and pathogens because their resistance is lowered. Isolation procedures are a group of procedures and guidelines for separating people to prevent the spread of infection and disease. These procedures play an important part in controlling the spread of infection and disease, and these procedures are meant, however, to isolate the germs, not the resident. The resident who is in isolation still needs a great deal of care and attention. Each communicable or contagious illness or disease may require a specific set of precautions to prevent the transmission of it. In universal precautions, there were 7 categories of precaution or isolation. In the new standard precaution guidelines, these 7 categories have been combined into one main category with 3 additional precaution and/or isolation categories. When using standard precaution guidelines, various personal protective equipment is required. PPE is specialized clothing or equipment worn for the protection against blood and body fluids or any other hazardous materials or substances. This equipment would be gowns, masks, gloves, face shields, and so forth. Every employer is required to provide personal protective equipment to employees at risk on the job for exposing themselves to blood or body fluids and any other hazardous materials or substances. You may notice some differences between the videos and the material in your workbook for the application of some of this personal protective equipment. The videos were filmed in 1994. The workbook contains regulations from 1997, the most current information and techniques. Now, Let's go over the standard precaution guidelines using the posters I was telling you about. All of these posters that I'll be showing you, you can get for your own facilities by writing or calling the Brevis Corporation. You'll find this information in your workbooks. The first poster is actually a more detailed version of the one that you have in your workbooks. The standard precaution poster. Standard precautions are used for all residents. It is difficult to know which of your residents have a contagious infection or disease just by looking at them. So it is vital that you use standard precautions when caring for all of your residents. This means when you are caring for residents, you will use standard precautions anytime there is a possibility of coming in contact with any body fluids. For example, this would be helping a resident brush their teeth, assisting them with toileting, emptying a catheter bag, collecting a urine sample, contacting any soiled Band-Aids, bloody gauze, that sort of material. Body fluids include blood, secretions, and excretions. Now, let's read through each precaution from the poster. The first precaution is to wash your hands. You may use plain soap for this. Wash after touching blood, body fluids, secretions, excretions, and contaminated items. Wash immediately after gloves are removed and between patient contacts. Avoid the transfer of microorganisms to other patients or environments. The second precaution, wear gloves. You wear the gloves when touching blood, body fluids, secretions, excretions, and contaminated items. Put on clean gloves just before touching mucous membrane and non-intact skin. That could be a bruise that has some open skin, a blister that's open. Change gloves between tasks and procedures on the same patient after contact with material that may contain high concentrations of microorganisms. Remove gloves promptly after use, before touching non-contaminated items and environmental surfaces, and before going to another patient, and wash hands immediately to avoid the transfer of microorganisms to other patients or environments. The third precaution, wear mask and eye protection or face shield. Protect mucous membranes of the eyes, nose, and mouth during procedures and patient care activities that are likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. The fourth precaution, wear a gown. Protect the skin and prevent soiling of clothing during procedures that are likely to generate splashes or sprays of blood, body fluids, secretions, or excretions. Remove a soiled gown as promptly as possible and wash hands to avoid transfer of microorganisms to other patients or environments. The fifth regulation, patient care equipment. Handle used patient care equipment that is soiled with blood, body fluids, secretions, or excretions in a manner that prevents skin and mucous membrane exposures, contamination of clothing, and transfer of microorganisms to other patients and environments. Ensure that reusable equipment is not used for the care of another patient until it has been appropriately cleaned and reprocessed. Single-use items must be properly discarded. Environmental control. Follow hospital procedures for routine care, cleaning, and disinfection of environmental surfaces, beds, bed rails, bedside equipment, and other frequently touched surfaces. Linen. Handle, transport, and process used linen soiled with blood, body fluid, secretion, or excretions in a manner that prevents exposures and contamination of clothing and avoids transfer of microorganisms to other patients and environments. Occupational health and bloodborne pathogens. Prevent injuries when using needles, scalpels, and other sharp instruments or devices. When handling sharp instruments after procedures, when cleaning used instruments, and when disposing of used needles. Never recap used needles using both hands or any other technique that involves directing the point of a needle toward any part of the body. Rather, use either a one-handed scoop technique or a mechanical device designed for holding the needle sheath. Do not remove used needles from disposable syringes by hand, and do not bend, break, or otherwise manipulate used needles by hand. Place used disposable syringes and needles, scalpel blades, and other sharp items in a puncture-resisted sharps container, located as close as practical to the area in which the items were used, and place reusable syringes and needles in a puncture-resistant container for transport to the reprocessing area. Use resuscitation devices as an alternative to mouth-to-mouth resuscitation. Patient placement. Use a private room for a patient who contaminates the environment or who does not or cannot be expected to assist in maintaining appropriate hygiene or environmental control. Consult infection control if a private room is not available. You will use these standard precautions for all residents. If you have a resident with an additional diagnosis, tuberculosis for example, you will use additional precautions which are called airborne precautions. Airborne precautions are precautions against illnesses that are transmitted through the current in the air. Examples of airborne transmitted illness or disease are measles, chickenpox, rubella, tuberculosis. When a resident is diagnosed with an airborne transmitted illness or disease, you will use standard precautions and airborne precautions. The airborne precautions include a sign that visitors must report to the nurse before entering the room. The patient should be placed in a private room that has monitored negative air pressure with 6 to 12 air changes per hour and a discharge of air outdoors or a HEPA filtration if recirculated. Keep the room door closed and the patient in the room. Respiratory protection. Caregivers must wear an N95 respirator when entering the room of a patient with known or suspected infectious pulmonary tuberculosis. Susceptible persons should not enter the room of patients with known or suspected measles or chickenpox if other immune caregivers are available. If susceptible persons must enter, they should wear an N95 respirator. A respirator or surgical mask is not required if the caregiver is immune to measles and chickenpox. For patient transport, limit the transport of the patient from room to essential purposes only, and use a surgical mask on the patient during this transport. The next precaution category is droplet precautions. Droplet transmitted illnesses or diseases are transmitted through droplets in the air. Examples of droplet transmitted illnesses or diseases are pneumonia, scarlet fever, meningitis, or influenza, the flu. When a resident is diagnosed with a droplet transmitted illness, for example pneumonia, you will use standard precautions and droplet precautions. These droplet precautions include a sign on the door that visitors must report to the nurse before entering the room. The patient should be placed in a private room if possible. Cohort or maintain spatial separations of 3 feet from other patients or visitors if a private room is not available. Wear a mask when working within 3 feet of the patient or upon entering the room. Limit transport of the patient from the room to essential purposes only. Use a surgical mask on the patient during transport. The third and last precaution we will talk about is contact precaution. Contact-transmitted illnesses and diseases are transmitted through direct contact with the resident or contact with items in the resident's environment. Examples of contact-transmitted illness and disease are E. coli bacteria, impetigo, conjunctivitis, scabies, and herpes. When a resident is diagnosed with a contact-transmitted illness or disease, you will use standard precautions. And, for example, a resident who has an additional diagnosis of scabies will require that you also use contact precautions. Contact precautions include a sign on the door requiring visitors to report to the nurse before entering the room. The patient should be placed in a private room if possible. Cohort if private room is not available. Wear gloves when entering the room. Change gloves after having contact with infective material that may contain high concentrations of microorganisms, fecal material in wound drainage, for example. Remove the gloves before leaving the patient's room. Wash hands with an antimicrobial agent immediately after glove removal. After glove removal and hand washing, ensure that the hands do not touch potentially contaminated environmental surfaces or items in the patient's room to avoid transfer of microorganisms to other patients or environments. Wear a gown when entering the room if you anticipate that your clothing will have substantial contact with the patient, environmental surfaces, or items in the patient's room, or if the patient is incontinent or has diarrhea, an ileostomy, a colostomy, or wound drainage not contained by a dressing. Remove the gown before leaving the patient's environment and ensure that clothing does not contact potentially contaminated environmental surfaces to avoid the transfer of microorganisms to other patients or environments. Limit transport of the patient to essential purposes only. During transport, ensure that precautions are maintained to minimize the risk of transmission of microorganisms to other patients and contamination of environmental surfaces and equipment. Patient care equipment. Dedicate the use of non-critical patient care equipment, for example, a stethoscope, a sphygmomanometer, a bedside commode, an electronic rectal thermometer, to a single patient. If common equipment is used, clean and disinfect that equipment between patients. Now that we've talked about standard precautions, we are going to go back to Ginny, where she is going to tell us, number one, how to clean up a blood or body fluid spill, and number two, how to put on an isolation gown, mask, and gloves.
Now, frequently, we'll have blood spills. Now, this refers to maybe some fluid that has blood in it, or blood itself, which you might find on the floor, or perhaps some spills on the sink, perhaps on the edge of a toilet.
Okay.
For purposes of demonstration, let's clean up this blood spill that you notice on the surface. One of the first things I need to do is to collect my equipment. I need to have a properly marked biohazard bag in which to put the waste. I need to have absorbent paper toweling in order to not just soak up the spill but clean the surface as well. I need to have gloves, one for each hand, in order to protect myself from the fluid that is here. And I need to have a germicidal solution that is properly registered. Remember, want to clean up not just the HIV, the virus that causes AIDS, but also the hepatitis virus as well. Remember that oftentimes you will be using a bleach solution, perhaps in a 1 to 10 solution, and the concentration may vary according to regulations as well as your agency policy. The bleach solution may or may not be changed daily or refreshed daily. This again will depend on the regulations at the time as well as your facility policy. In order then to clean up the spill, the first thing I must do is, of course, put the gloves on. Now that I have my gloves on, the next step would be to take your absorbent toweling and place this on the blood spill in order to absorb the liquid. You notice the capillary action will soak up that blood spill, will allow this material to be soaked into the toweling. The reason that it is being soaked up and not just with my hand spread around is so that I can avoid contaminating further surface area around this blood spill. By allowing the fluid to soak up, I am containing as much of that liquid in that area as possible, making sure that I soak up all of the liquid so that my area is actually free of any visible fluids. I then will put that in the plastic bag that is designed for infectious waste. Making certain then that this surface is clean, I now will spray the area thoroughly with my disinfectant germicidal solution and with another paper towel thoroughly cleanse the area. And again, working from clean to dirty, making sure that I clean the entire area where that blood spill was located. Disposing of that in the container that is for infectious waste, I now must disinfect the area. And to do this, you then again add this disinfecting solution that is required. And at this point, you want to leave that solution on for the proper amount of time, and it can be anywhere up to perhaps 20 minutes. If the area has dried 20 minutes later, fine. If not, then you would be required, of course, to take your absorbent toweling and to clean up again any liquids that might be remaining on the surface. And you notice I'm starting from the outside and working toward the inside where the spill would be. When I have finished this, I dispose of the materials in the plastic bag. At this point, I must remove my gloves. And what's important here is that as I remove my glove, you notice that I am putting my hand on the surface of the glove. I am not putting my hands farther up where I would touch my clothing or my skin. I remove the glove, holding it in my other hand. I now put my finger under the clean surface of the second glove and just simply wrap those two gloves together, disposing of them in the contaminated waste bag. Handling the outside of my contaminated bag, the outside would be the clean side, holding it away from my face so that any air that is expelled is away from my face. I will now tie that bag, securing it so the contents cannot come out. I will then dispose of this bag in the proper waste receptacle in the utility room. In turn, this will be decontaminated probably by being burned with other infectious waste from your facility. Now all of these, the gown, the glove, and the mask, are very important items that you use as infection control measures. We're going to work with Phyllis again, and she's going to demonstrate the proper use of each of these items. When using the gown, you usually have a choice of either the paper gown, which Phyllis is holding up, and you'll notice that this is yellow, the typical color. As she opens it up, you'll notice that it has sleeves. It's certainly the length of the cloth gown, and it has tabs that you will attach in the back. It also has ties. But let's have Phyllis put on the cloth gown, which is very similar, and you'll have a chance to see how that cloth gown is used. The cloth gown, again, is full length, has sleeves that are going to cover your entire arm. You notice that as she opens it up and puts it on, she keeps it off the floor, and she puts it on so that her front will be totally covered. The opening will be to the back. The sleeves are going to come right to the elbow, the wrist. I do know my difference, folks. And you'll notice that she's in a clean area, so she can touch just about any part of that gown she wishes to. She's going to totally cover her backside to make sure that the back of her clothing is covered. And you have to be able to tie the strings behind your back for sure. And again, don't make a knot. She's going to make a bow so that all she has to do later is reach for the string. Your gown should be tied at the top, and you'll notice that she will find the two neckties, bring that around, and then tie that also behind her back, overlapping as best you can the back of the gown. I know from my experience there are times when I have had patient isolation gowns that did not have neckties, and when that occurs you certainly want to at least tie the waist ties, otherwise get a new gown. Important part of the gown is that the neckties are always considered clean. That whole area where you see Phyllis right now with her fingers is always considered clean. Dirty hands never touch that area because it's next to your face. The next thing Phyllis needs to put on is her mask. She's going to take from the disposable mask container a one-time use mask. These are never reused. She's going to put the top of the mask where there's a metal piece that will be able to bend to fit the shape of your nose. That will fit under your glasses to keep your glasses from steaming up. She will tie the upper ties first behind her head, and again, do not knot it. Make sure that you have a bow. And then she will do the lower ties also behind her head so that the mask is secure. The mask is always worn covering both the mouth and the nose. It's important that that really be covered. Those of you that wear glasses, again, realize you may have to adjust that metal bar purposely so that it fits the nose and keeps your glasses from fogging up. The next thing that Phyllis will put on are gloves. And gloves are usually put on last because you do have some tying to do with your mask, but also the gloves are important to cover the cuffs of your gown. And as the gloves go on, and she's using the latex gloves this time, which you'll notice fit the hand very snugly, she's covering the wristbands, the cuffs of her gown. Now, with this equipment in place, she should be fairly well protected. Now, we know this is not 100%, but it certainly will keep a good portion of the microbes and infectious material off of her clothing. And it will all serve a purpose of protecting both you and the patient. With this now, Phyllis would need to take whatever else equipment she needs, perhaps a red bag, perhaps if she needed lotion, soap, whatever she would need, she would now take into the patient's area and proceed to do patient care. You notice now that Phyllis is ready to come out of the isolation clothing, mask, and gloves. She's in the dirty utility area now, or the bathroom area, or the wash area. She will first take her gloves off, and you notice that she holds that one glove in the other hand and slips her clean fingers or her ungloved fingers underneath the surface of the glove. Now remember, the rule is always when you take your gloves off, you wash your hands, and Phyllis will wash her hands. And just for the sake of demonstration, we'll wash, but not probably quite as long as you might if you were truly doing this. Making sure, again, you use good friction soap, warm water, get all the places on your hands washed. Now, Phyllis has the type of sink where you use foot pedals, so she does not have to use a paper towel to turn off the faucet. And because that is paper towel, should not contain infectious waste, that will go into the regular trash, usually a brown bag. The next thing Phyllis does with her clean hands is reach to the cleanest part of her gown, which would be the neck ties. And again, that is always considered clean. She then reaches to the back of her gown to untie the waist ties, pulling it to the front and then gradually pulling the gown off of her shoulders, holding it in front of her, away from her clothing and off the floor, rolling it in a tight ball, keeping the pieces of the gown from flipping around, spreading germs. She will simply put it into the infectious waste linen bag. Now at this point, because she has touched the gown, she'll want to wash her hands again before she reaches to touch the ties around her face or her head. During isolation, it's important you realize that you wash your hands a lot. Now, I would encourage you to wash your hands more than you probably think you need just to be safe, but you should wash your hands frequently. Then she will need to take her ties. The first one is always the lower tie is removed first. This keeps the mask from falling down around your chest and touching your clothing. Then she goes to the top string and undoes that. And notice when Phyllis takes it off, she holds the mask only by the string. She does not touch the face mask part, which truly is quite germy after receiving all the moisture from your nose and mouth. That goes in the infectious waste container. And then one more time, Phyllis will either wash her hands here or in another area where she can, of course, proceed to her next skill or duty that she would be doing.
Again, welcome back. I'll bet you never thought putting on a gown, mask, and gloves could be so complicated. You may never have to use isolation procedures in your CBRF, but if you do, your technique in performing these procedures is vital to controlling the spread of infection. It is important that you are using the most current precautions. Precautions are continually evaluated and changed as necessary. From 1985 to the present, there have been many changes. For example, in 1985, the use of gloves occurred only in cases of known infection. In 1996, as we have just discussed, the use of gloves is required anytime there is contact with any body fluid. In this final segment, Part 3, Ann Hansen, who is an infection control practitioner, will discuss blood-borne pathogens and standard precautions. Now, let's go to Ann.
In today's video lesson, we'll be talking about blood-borne pathogens. Pathogens, as you recall, are germs that can cause disease. Blood-borne means that they're found in a person's blood or possibly other body fluids. The two blood-borne pathogens that we're going to discuss in more detail today are HIV, the human immunodeficiency virus, that's the virus that causes AIDS, and hepatitis B virus, which I'll have abbreviated HBV in many of the visuals you'll be seeing today. Let's start by taking a closer look at HIV. HIV is found in blood, semen, vaginal secretions, and breast milk of people who are infected with the virus. Other body fluids may contain HIV, but have not been proven at this point in time to transmit the virus. There are three ways that a person can become infected with HIV. The first is through sexual contact with a person who's infected. That can either be homosexual contact or heterosexual contact. Virtually any type of sex that involves a body fluid exchange could pass the virus from a person who's infected to a non-infected person. The second route of spread is from mother to unborn child, and this may actually occur when the woman is carrying the baby in utero. The mother may pass the virus to the child. It may also occur at the time of birth, where there's a lot of mixing of the mother's and the infant's blood. About 1 in 3 infants born to HIV-infected women will become infected with HIV, so it's not an automatic thing. The third recognized route of HIV transmission is blood-associated. People who inject drugs and share needles are the largest risk group or risk behavior in this category. Also, people who've received contaminated blood or blood transfusions or blood clotting factors. Most of that is prior to 1985, though, because since 1985, a blood test has been available to test the blood supply for antibodies to HIV. The third route under blood-associated would be that of infected healthcare workers or people who have occupational exposure to blood. HIV is not spread through casual contact, through activities like hugging or kissing, sharing a bathroom, using the same tub or pool, sharing utensils, sharing a meal. If a person's HIV infected and they cook your food, that is not a way for you to become infected with HIV. Also, insects cannot spread the virus to people. That has been proven. In order to understand how HIV causes AIDS, let's take a look at how the normal immune system functions. Our immune systems contain a number of cells that help to fight off various infectious agents and possibly cancer-causing agents that our body is bombarded with all the time. Those are shown on the left of the slide. The T4 white blood cell, shown in the middle here, is sort of the traffic cop of the immune system. This cell tells all the other cells, shown here on the right, how to act, what to do, what to release to protect the body from those various assaults. What happens with HIV? HIV is a virus. It likes to live inside of cells. That's the only way it can grow and make more of itself. The cell that it likes to live inside is the T4 cell. So when HIV gets inside a person's bloodstream, it seeks out the T4 cells and sets up shop there and starts to grow, multiply, make more of itself, and the new HIV organisms go on to infect more T4 cells. So that in time, a person's T4 cells become severely damaged or depleted to the extent that the control in the immune system is lost. So we continue to have all of the cells poised and ready to go, but no one is telling them what to do anymore. What happens is the body becomes overrun with different types of infections and possibly different types of cancer. A person is said to develop AIDS once their T4 cells have become depleted and they start to develop signs and symptoms of some of the infections. Some of the conditions associated with AIDS might be fever, diarrhea, fatigue, weight loss, and night sweats. Keep in mind with these symptoms could be seen in other disease states. The important thing to remember about when a person has AIDS is that the symptoms are really unexplained by other medical conditions. They're very persistent, meaning they don't go away easily, and they're very, very profound. So it's not uncommon when a person develops their first bout of AIDS to have severe night sweats to the extent that they have to change their sheets at night, and weight loss sometimes in the realm of 30 to 40 pounds in just a few short months. Some other conditions that people with AIDS may have are unusual skin lesions, rashes, or blotching on the skin, different types of skin cancer, a dry, hacking cough, severe confusion and dementia. This happens when a person has the later stages of AIDS where the virus actually runs out of T4 cells to live and will start to live in the brain and cause some damage there. Other conditions associated with AIDS include TB and other what I'll call opportunistic infections, things like pneumocystis pneumonia, cryptosporidium diarrhea, and thrush. It's a yeast infection in the mouth. These are infections caused by germs that are common in the environment, but when a person has a suppressed immune system, they can cause an infection. So we need to think of HIV infection as a spectrum of infection, where when a person becomes infected, they have absolutely no signs or symptoms of infection. And as the T4 cells become depleted, eventually they will develop AIDS. On the average, it takes about 12 years for a person who would become infected today to develop AIDS. We need to keep in mind that people with AIDS really only represent the tip of the iceberg in terms of the risk that we face on the job. If we were to follow protective measures only for people who told us they had AIDS or had signs and symptoms of AIDS, we would be fooling ourselves, because there are a lot of people on the lower half of the pyramid, lower portion of the pyramid, I should say, who are infected with HIV, and often we do not know who they are. The next bloodborne pathogen I'd like to talk about is hepatitis B virus. Hepatitis literally means an inflammation of the liver. There are a lot of different things that can cause your liver to become inflamed. Some of them might include various medical conditions, exposure to certain chemicals, exposure to viral infections of sorts. When the hepatitis B virus gets inside a person's bloodstream, remember I said viruses like to live inside of cells. The hepatitis B virus travels to the liver and sets up shop there. Once it's in the liver, it starts to cause liver damage. The incubation period, or the time that it would take for a person to develop symptoms for hepatitis B, on the average is about 2 to 4 months. Now, not all people with hepatitis B have symptoms. Only about half of the people who have hepatitis B infection will ever have any symptoms at all. If a person does develop symptoms, they might be things, again, that could be seen with other diseases as well. But they would include fatigue, abdominal pain, diarrhea, jaundice, that's a yellowing of the skin, sometimes seen in the nail beds or the whites of the eyes, vomiting, mild fever, muscle and joint aches, nausea. Often with the diarrhea and jaundice too, you'll see a lightening of the stool and a darkening of the urine. Those are key signs that someone may have a problem with their liver, like hepatitis B. When a person is infected with hepatitis B virus, a number of body fluids may carry the virus. Blood, semen, vaginal secretions, any bloody body fluids would be considered highest risk. Additionally, other body fluids such as urine, saliva, sweat may contain the virus and spread it to other people. About 90% of the people who get hepatitis B eventually recover. That means that their body makes a substance called an antibody that takes the hepatitis B virus out of their bloodstream and cures them from the infection. Even though they recover, hepatitis B is not an easy disease to overcome. The average person who gets hepatitis B and is ill from it loses about 6 to 7 weeks of work and is often hospitalized and may actually battle the infection for around 7 months. So even though they recover, it's still not an easy disease to deal with by any means. About 1% of the people who get hepatitis B infection will die from the initial assault of the infection. The remaining 5 to 10% of people with hepatitis B become what is called a chronic carrier of the hepatitis B virus. And what that means is that their body is not capable of making the antibodies, or it may make antibodies that just are not effective at eliminating the virus from the person's blood. So a hepatitis B carrier continues to have hepatitis B in their blood and body fluids and can shed those viruses in those fluids and spread infection to other people. What's significant about being a hepatitis B carrier is that there are many medical conditions that a person would then develop. About a quarter of all hepatitis B carriers develop chronic hepatitis and cirrhosis of the liver. Another 9% at some point in their life will develop cancer of the liver, which can be fatal very quickly. The remainder of the people who are carriers may remain without symptoms and again shed the virus in their body fluids unknowingly to other people. The vaccine is given in 3 doses over a 6-month period. It's not a guarantee that you will have immunity to hepatitis B virus. Only about 90% of those receiving the complete vaccination series will in fact develop the antibodies that will protect them from infection. Hepatitis B vaccination is very safe. It's been given to millions of people worldwide. It's not made from any blood or blood products, so it's not possible to spread hepatitis B or HIV or any other infectious disease to you. Hepatitis B is also a lot more common than AIDS. About 1 in 20 Americans has or has had hepatitis B at some time in their life. And there are 300,000 new infections per year in the United States, despite the fact that there's a vaccine available to prevent the disease. If a person is stuck by a needle that was used on a person who has HIV infection, the chance of becoming infected from that single needle stick exposure is about 1 in 350. It's actually quite low. If you compare that to the same scenario with hepatitis B, if a person is stuck with a needle that was used on an infected or a person who's carrying the virus on that type of source, the chance of becoming infected is 1 in 3 if the person has not received hepatitis B vaccination. So that's a really good reason to get hepatitis B vaccination. Hepatitis B virus is capable of surviving in dried blood or body fluids for around 6 months, and it can pass on infection to other people. Another important difference between the two viruses is that hepatitis B is a little bit easier to spread in the household setting. What I mean by that is if a person is infected with hepatitis B virus, it's very likely that other members of their family will come down with the infection also. And it's not necessarily that they have a body fluid exchange. It's just that in some of the daily living activities, like maybe picking up the wrong toothbrush or sharing a razor or using the same drinking glass, there could be an exchange of saliva, which has been proven to spread hepatitis B, saliva or possibly other body fluids in that circumstance. Hepatitis B can also be spread by human bites, whereas HIV cannot be spread by that route. A good rule of thumb is to always make sure that broken skin, any areas where you have non-intact skin on your hands, is completely covered at all times. Even though you may not anticipate your hands contacting blood or body fluids on the job, and you may think, well, I'm going to wear gloves for that procedure, it's no big deal. You have to keep in mind that gloves are really only a crude barrier. And if you would contact blood by accident, say you're changing sheets or something and have no reason to be wearing gloves for that purpose, and you come across blood in that situation, if you had your hands covered, you would be protecting yourself a little bit more. Gloves are required for any direct contact with blood or body fluids, mucous membranes such as the eyes, nose, mouth, or vaginal area, or any non-intact skin. They're also required if you are having contact with any contaminated surfaces, equipment, waste, or linens. Very important in these situations to wear gloves. Gloves should also be worn for handling all body fluid specimens, for assisting a patient with toileting, for any contact with open skin or wounds. Say you're bathing a patient who has open skin, or if you bathe a patient who might be incontinent, that would be a reason to wear gloves. An important thing about gloves is to remember that they're single use, and they should only be worn for that immediate task. In other words, if I'm going to wear my gloves to assist a patient, say on the toilet, I wear the glove for that particular task, and when I'm done with the task, I don't walk out into the room and touch other things with these gloves on. The purpose of the gloves, yes, is to protect myself, but if I walk around with contaminated gloves and touch other areas of the room, I'm really causing a source of cross-contamination that can be spread to other patients in the facility. So it's real important when I'm done with that immediate task to remove my gloves, and whenever gloves are removed, your hands must be washed immediately. Utility gloves, like your heavier gloves that you would use for dishwashing in the home setting, may be used for cleanup types of procedures and often offer more protection to you. Those gloves may be washed when you're finished and disinfected. However, the latex or vinyl exam gloves that you wear routinely may not be washed or reused between patients. Another important thing we need to do to protect ourselves from contacting blood or body fluids on the job is to wear adequate facial protection. On our faces, we have eyes, nose, mouth. Those are all areas of entry for body fluids and possibly for bloodborne pathogens. There are a number of different devices available to protect your facial area. The important thing to remember is that when you have eye protection, if you wear regular prescription glasses, that is not adequate eye protection. You do need something that has a side shield on it, so something like a tight-fitting goggle, or you can add the actual side shields to your prescription glasses. You could wear the separate glasses in combination with a mask, or you could wear a device such as this, where I'm wearing a mask that's covering my nose and mouth, and also a face shield that's protecting my eyes completely. Different facilities will have different types of personal protective equipment, and it's very important to become familiar with the location of that equipment and to make sure that you know where it is and how to use it. Masks should always be worn for emptying any body fluid containers. Say you're emptying a catheter bag into a toilet or hopper, or emptying a urinal or bedpan. You should always cover your face in that situation. You may feel that you don't need to do that, but that is a practice that will generate splashing and often can cause an exposure. You should also wear facial protection when cleaning up large amounts of blood or body fluid. Say you have soiled sheets or something like that. If there's a possibility that anything will splash or spray to the face area, you should have both the eyes, nose, and mouth covered during those procedures. It's also important to cover our clothing if we're going to be doing anything that could result in splashing or spraying of body fluids to the clothing, or even touch contamination to our clothing. So say we are changing the soiled linens, this might be a time where your uniform might become contaminated. So it's real important to cover it up with a protective gown, which would then be removed right after that procedure. There are a number of different types of gowns available, and the selection of the gown really just depends on what you would use the gown for. They can range in anything from a simple plastic apron with the sleeves exposed to a full cover gown that's fluid resistant with long sleeves and cuffs on the sleeve. As we've seen, barrier protection is a very important part of infection control. But just because we use these barriers, it doesn't mean that hand washing isn't important. Hand washing is still the most important thing we can do to prevent the spread of infection to other patients and to ourselves. Hands should always be washed after gloves are removed, after body fluids are touched, or after touching any items that might be contaminated with body fluids, after toileting yourself or a patient. They should also be washed before feeding or food handling, before handling of any clean linens or clean materials, before starting work, before leaving for break, lunch, or home. The majority of people who've become infected with a bloodborne pathogen on the job have picked up the bloodborne pathogen through a puncture wound injury of some type. That can either be through a needle stick injury with a contaminated needle, with bloody glass, a bloody wire, anything that's sharp and could cut you and contains body fluids represents a risk to you on the job. So it's important to know how to handle those. We have sharps disposal containers, and generally these are located in most rooms or in strategic locations throughout your facility. Become familiar with where they are and how they're used. It's important that all disposable sharps are immediately deposited into these containers. The one I have here has a drop zone in where I would just deposit the sharp into the container and close the lid. An important thing to remember about the use of these sharps disposal containers is that the containers should not be overfilled. When the containers are nearly full, they should be closed, and whatever procedure is in effect in that facility for removing them, that should take place at that time. Never try to stuff one more needle into the sharps box. That's a good way to get stuck. Keep in mind also that only sharps should go in the sharps box. You shouldn't be putting things like gloves or other protective equipment in there, because it's going to block the drop zone of the sharps box and possibly cause you to become injured. Should you have broken glass or broken wires, whatever, something that needs to be swept up, it's important that you do not contact those with your bare hands. You can either use a tongs or a dustpan and broom to pick up the broken glass, and then it should be swept into the sharps container. Needles should never be recapped, bent, or broken by hand. They should be placed in their entire condition directly into the sharps container. It's also very important to not use your body to compact waste or linens. If the trash container is full, it's a good idea just to have it emptied at that time. You shouldn't be sticking your foot in there to compact trash. Also, if you're carrying a linen bag or a trash bag, carry it away from your body, or if you're pushing it down a chute, try not to use your body to do that. Sometimes sharp items end up in our waste and linen even though they're not supposed to be there. And it's just important that when we handle waste and linen that we're aware of the fact that sharps could be there and use the appropriate precautions. If you should happen to see a needle in a wastebasket or in a place where it doesn't belong, just be very, very careful when going to retrieve that needle. You don't want to stick your hands right into a waste container. If there's one needle there, there might be two needles there, and that would be a good way of becoming injured. Always report stray sharps or unsafe equipment that represents a hazard of exposure to your supervisor immediately. It's very important, even though no one may have become stuck from the situation, An unsafe situation like that represents a risk to everyone in the work environment, and it's very, very important that that we report those situations so they don't occur in the future. There are some wastes in the healthcare facility that we need to separate out as biohazardous wastes. They would include items that are contained in our sharps containers, any bulk, blood, or body fluid, and those can generally be poured down a toilet or hopper situation. They shouldn't be thrown in with the biohazardous waste. Any human tissues or laboratory wastes are also considered biohazardous wastes. Any items that would be saturated with a person's blood or body fluid, such as dressings, toweling used to clean up a blood spill, that sort of thing. Those would all need to go in a biohazard container. This is the universal biohazard symbol, and it would be used to label sharps containers, any bags containing our infectious or biohazardous waste, and in some facilities it may be used to identify laundry that may be more contaminated with blood or body fluids. We've talked about all the different things you can do to protect yourself from contacting bloodborne infections on the job. It's also important, though, to know what to do when you have an exposure episode. Exposure incidents are those that are capable of spreading a bloodborne pathogen to you. And as you may have surmised by now in the course of this video, those would include any type of puncture wound with a contaminated object, such as a needle or broken glass. If you should get any blood or body fluid in contact with your eyes, nose, mouth, or any areas of broken skin. These represent ways to get bloodborne pathogens, and they're termed significant body fluid exposures. It's important that when you have an exposure like this, that you follow 3 simple steps. The first, and probably the most important, is to give yourself immediate first aid. In terms of a puncture wound injury, this would mean going to the sink and trying to bleed the wound into the sink as you wash the punctured area and wash your hands while doing that. Should you get a spray of body fluids to the eyes, nose, or mouth, those areas should be irrigated with water for 15 minutes. And generally that requires the use of an eye wash station. And you should become familiar with where that type of facility might be in your particular institution. The second step is to report the exposure to your supervisor immediately. You will not be reprimanded for having an exposure. It's very important for documentation purposes and to make the work environment safe for everybody that you report your exposures, because if you became exposed, possibly someone else could also. So you need to report it right away with your supervisor, and you probably have a little bit of paperwork to document the circumstances of the exposure. The third important step is to see a physician for evaluation as soon as possible. Generally, this means prior to the end of your work shift, you should be seen. In conclusion, we've talked about a number of infection control practices that can make the work environment safer for you and the facility safer for your patients. Should you have any additional questions, your instructor can assist you on this. Also, be sure to check your facility's manuals and policies and procedures. Most of the information outlined here today is detailed in those policy and procedure manuals.
Welcome back. I think bloodborne pathogens is an especially difficult topic to simplify, and Ann did a really nice job on that. Now, I hope you're all ready to take the post-test. Remember, the pre-test and the post-test are both the same, and you will not be graded on your responses. We will review your responses after you have taken the post-test. Now, turn off the videotape and complete the post-test in your workbook. Welcome back. Let's go through the standard precautions post-test responses at this time. The first question, the most important guideline to follow for preventing the spread of infection is, the correct answer is C. Wash your hands before and after caring for each resident. Number 2, Pathogenic microorganisms are microorganisms that, the correct answer is C, that cause disease and infection. Number 3, microorganisms are spread by D, all of the above. That would be by direct contact, indirect contact, and airborne spread. Number 4, standard precautions. D should be used for all resident cares. Number 5, standard precautions include B, wearing gloves when doing certain procedures. Number 6, the CBRF regulations, HFS 83, state that A, any employee who may be exposed to blood or potentially infectious material shall successfully complete training in standard precautions before assuming any job responsibilities. Number 7, isolation procedures are, the correct answer is D, all of the above. An important part of controlling infection disease. B, a group of procedures and guidelines for separating people to prevent the spread of infection and disease and to protect yourself and others. Number 8, the HIV virus can be transmitted by B, sexual contact. Number 9, the HBV virus, A, can survive in dried blood or body fluid for 6 months and still pass on infection. 10, you have punctured yourself with a contaminated object. You would, B, bleed the area and cleanse it thoroughly. 11, you have just come upon a blood spill. You would, A, clean it up immediately with a disinfectant bleach solution following the facility's procedure for blood spills. 12, you have just emptied a catheter bag and urine has splashed up into your face and mouth. You would, C, irrigate the entire area with water for 15 minutes. This will conclude the standard precautions in the CBRF unit. I know that this has been a lot of information to digest. If you have any questions that weren't answered on the video or in the workbook, ask the nurse at your facility or contact the Wisconsin Department of Public Health Occupational Health Section for more information on standard precautions. You have now completed the unit on standard precautions in the CBRF. As you use the information you have learned, you will keep yourself and the residents in your care safe from the spread of infection.